Hi, everybody. This is Dr. Lauren Allison, and I am here with Dr. Nicholas Meyer, who recently has produced a book called The Holistic Dental Matrix, which I've been reading and I think is very cool. And so Dr. Meyer is here to go over some of the book materials. We're going to try to cover a little bit of information at a time. And so there will probably be more than one Skype interview with respect to this material. So Dr. Meyer's a DDS and a DNM, so I'm assuming that means Doctor of Natural Medicine. Is that
Yes,
correct?
it does.
And
Yes.
is there anything about that you would think needs more explanation, or stands by itself?
It stands by itself, but it's because of the things that I've learned along that world of natural medicine that
Yeah.
brought into dentistry that gave me the kind of flavor and the flair that I brought everything together for the book.
Right.
And it's not just purely a dental point, a traditional dental point of view, in other words.
Sure. Yeah. Well, I think a lot of people, yeah, at least people that that I see and people that I talk to, are aware of on certain levels a lot of these issues, with respect to dental and health in general, and obviously biocompatibility and so forth.
Right. Exactly.
So you seem to, from what I can take in so far, is that you got started kind of early. Historically, it looks like you got started a little earlier than most in holistic dentistry, kind
Yeah.
of organically, right? As
Yeah.
it was
That's correct.
developing, and so what is your either definition or how do you look at things with respect to holistic dentistry?
Well, that's holistic dentistry to me is really looking at the person as a whole, and it's easier said than done sometimes.
Right.
And and traditionally in dentistry, dentistry was broken apart, broken out of medicine in the early 1900s, and excuse me, when that happened, that shift happened, dentists, for let's say for the most part, seems to me, became relegated to more of a mechanical orientation, fixing a tooth, repairing it, so to allow an individual to continue to chew, to masticate, to look good, to talk well. So those were all the mechanical parts of it. Well, the transition for me occurred when I got into I had an inquiring mind and I wanted to know, why do people have chronic facial pain? I don't know why. It was just a nagging little thing in my brain that said I needed to answer that. So that was my entree into the world of something outside than just fixing teeth. The background with that brought a whole different flavor of awareness, acupuncture and chiropractic. I'd never had a chiropractic adjustment or a spinal adjustment until that time. I've gone to a seminar and they suggested people that are doing this kind of work need to hook up with a chiropractor so that we have a tag team approach, because now we're dealing with full body mechanics, not just the apparatus of the jaw.
Yeah.
So that really was a paradigm shift for me, because I was schooled and just had come out within the last few, those at the time, a few years, and thought I knew everything. I was just so arrogant about what I knew, and then I rapidly found out how much I didn't know.
Yeah.
So that changed for me how I started to think about really everything. And as my journey in life continued and going on, really around the foundation of bite, jaw, balance, and then everything else, body mechanics, and then I find out about acupuncture, and then I find out teeth are related to the rest of the body through acupuncture meridians, and all kinds of things were going on. And I'm looking at this, I'm interfacing now out here in Arizona with naturopathic physicians, homeopathic physicians. There are a plethora of these kind of practitioners here, chiropractors, craniosacral therapists. So these are the people that I have around me and help support what I do, and I support what they do.
Yeah.
So that is a big flavor. And then the beyond just the chronic facial pain person, I got into the treatment and management of chronic diseases, of which dentistry has oftentimes a pivotal role in regaining somebody's health.
Sure.
So I started with all the different education, and so 30 years ago I started this journey with TMJ problems, people with jaw clicking, popping, headaches, blah blah blah, all the kind of symptoms that are associated with that.
Yeah.
Then I got involved for somewhere along the line early on with mercury. The question was posed, well, maybe mercury isn't such a good idea, from a dentist, a well-known dentist. Well, what's that about? I'm thinking.
Yeah.
Well, so I became aware of that, and an early experience in my practice life with my office receptionist was stricken with, came down with multiple sclerosis, and she come out to the West and to Nevada and to the Nevada clinic and had an experience and with them and energy work and all kinds of stuff I'd never heard of.
Yeah.
Electrical readings, and she brought back a thick ream of paper about 1/8 of an inch thick of teeth relationships to the body and all this stuff that came out of Germany, and I'm like, oh my God, I don't understand any of this.
Right.
And so now I still have the same papers. I have them in my files, or they've stuck with me for 30 years. And they set, really, I didn't know this at the time, but obviously so, the tone and the tenor for what I was going to be doing now, and how I came around to the idea of the matrix, this book.
Yeah.
So the book started as an idea. I had an inspired moment on the beach over in California when I looked at my practice life. I said, what do I do? I said, I treat chronic pain, and in TMJ area there are 50 acknowledged symptoms for that component in my world. I know there's more than that, but there are 50 medical ICD numbers attached to TMJ. And then I'd gotten into, as I mentioned, just a mercury. So I wrote down all what I could find on mercury toxicity, the kind of problems that people have with mercury in their body. And I says, well, fluoride's an issue too. So I wrote down those in fluoride. And then I got into sleep apnea about 10 years ago. I first exposed to it 25 years ago, but really sunk my teeth into it about 10 years ago, give or take. And okay, now we're visiting stroke, diabetes, anything that has to do with chronic inflammation. And then I got involved along the way with mold toxicities and biofilm illnesses. And so they started filtering into the thought process that I have. So my practice now is a national practice because of all these different components. And I see that vision that day on the beach. So to continue that briefly, so I wrote out all these medical problems that people have. I wrote down going on like a spreadsheet on one side of it. I said, what would be a medical treatment, say, for headache? Well, it could be physical therapy. It could be some kind of a drug. And then I said, well, on my side, in my world, if that's a headache, it could be TMJ problems. So I'm going to look and say, I'm going to put down, I need a bite appliance, diagnostics and bite appliance. And that's going to actually take care of a whole lot of those medical problems. And I said, well, and then, so I just went down. So if somebody had, within the sleep apnea world, stroke, for instance, that's, circulation problems as a consequence. Well, stroke would be medication. It may be some kind of rehabilitations. And I said, I'm going to make a TMJ appliance, or make a sleep apnea appliance, because these are consequences of all these things. And I just went down, and the sheet expanded laterally. And so the book, it has a chart in it. The matrix chart is in it.
Right.
There are 142 medical conditions that are either caused in dentistry, treated in dentistry, or related significantly within dentistry from a management perspective. So that's how that whole thing swirled around in my mind. It took a good long while to really codify it and get it laid out nicely so it looks like something legible and readable. And then I created the book around that.
Yeah.
So that's kind of the story of how that happened. So my view then of holistic dentistry, to come back at your initial question, is really everything that's what the book is about, when that's chronic health conditions caused or treated by things which occur in and around dentistry.
Right.
And I poke a whole lot of holy bears. There's sacred cows that we have in dentistry, and I know there's some things which are not popular or
Sure.
Mainstream, but this is my practice. These are my personal experiences with people, and in this world of integrative healthcare, we are really stepping outside that tightly defined box of what is a general dentist, and I expanded that significantly. And there are times when I step back, I don't even know what kind of practitioner I am anymore. I use the tools of dentistry. I use energy medicine. I use conventional medicine. So it's the aim is getting help for the individual coming for care when they've been going around and taking themselves to doctor, and they may have had a bag full of vitamins, nutritional supplements. Not to say they're bad, but it's just a part of the picture. A part of the picture. And the other part that's fascinating is the whole world of energy medicine and what we can do on the subtle energy levels with people in homeopathy. And I use lasers in the practice and some herbal medicine occasionally. And we use the supplies then in dentistry for the support of that in that holistic world of non-toxic toothpaste, for instance, non-toxic herbal-based mouth rinses. So things like that. We don't use fluoride in our practice, for instance. We don't advocate it. People can come here that have a similar belief system and not get a battle from their prior dentist and say, "Oh my gosh, you have to have fluoride. So teeth are going to rot out of your head."
Right.
As an example. And I say, well, tooth decay is not a fluoride deficiency. It's the wrong model.
Right. Yeah.
So,
I think a lot of people are becoming more aware of that too. Obviously there's a lot of information coming out about that, and I think, and I saw a reference in the book to using homeopathy for detox.
Yes.
Now, it's interesting, and I don't want to jump too far ahead. There's lots of things that could be discussed, but it's interesting because in my practice I see that homeopathics work very well, and I have both lab before and after testing showing that homeopathics actually will detox metals fairly well when there's nothing else being used, like chelation and so forth. Is that something that you've seen? Is that how, like for instance, what would be your approach to? I mean, if I realize there can be a number of factors involved, but your approach to detoxing for metals or say mercury, as a holistic approach.
Right. So I mentioned here in Arizona, we have many practitioners, the naturopathic community, the homeopathic community, the chiropractic community. I am a dentist, first and foremost. I associate and affiliate with practitioners that's what they do better than what I would do.
Yeah.
Because those practitioners recognize that they can't do dentistry. I could do their detox, but I like to say I support that community because I can only do the dentistry. They can't do dentistry. So my time and resources and the value of my hands and my mind is in the performance of dental treatments for people.
Right. Okay.
Supporting this big picture.
Right.
So I have chosen, even though I know a lot about the detox world and I've seen the results of what you're saying on the tests befores and afters, and chelation or not chelation. There's a whole lot of different modalities, obviously.
Right.
So we have, for me in my house here, because I have the rich resources, we have lots of providers all around here. We have the Southwest College of Naturopathic Medicine 20 minutes away from me. So I don't need to rely on me and worry about reading labs and changing this and that for people. Yeah. I get that done elsewhere, and I focus on what I do best, what they can't do. They can. I don't want to really overlap too much of what I'm doing and take away from them, so to speak, because they can't do the teeth stuff. Only I can do the teeth. Yeah. And we do that very well.
I see. I get it. So from your perspective, like as an example of when a new patient comes to your office and you have evaluation forms or on computer that also try to delineate other physical issues, some other pains and stuff that you can correlate with those teeth based on other teeth, just so you get a bigger picture? Is that sort of what you're
and it goes, yeah, so it's, how can I best answer that? The depth and breadth of the knowledge that I've acquired over the years has given me the opportunity to filter fairly rapidly now the medical conditions, the buzzwords that they're putting down on their intake forms, for instance.
Sure.
I go right to, again, it's all up here, the chart, which is in the book.
Right.
So it resides up here. So I just look at that and I say, these are the items when they come in, I'm going to talk about, because I've already pretty much pre-screened diagnosis just by what I know. And then I do the exam just to do the fine-tuned correlation between this and that. And then, as an example, I have a person I'll be seeing here in a little while that I'm working directly hand in hand with his naturopath, who uses meridian assessment analysis, or electroacupuncture, to use a different terminology. And there are things that I can't see. There are things that I see, but I would like to have a different corroboration with that from a different set of eyes, to really take my influence out of it and to say, okay, yeah, this is really something that's of value for this individual. When there's a question in my mind, if I don't trust myself on my analysis, for instance, I have a backup to corroborate with what I'm seeing. So this is an individual just like that, that's got some significant health challenges, and the focus is around teeth. And I know when we get to it, we'll talk about some microbiology. I've been a year-long now clinical research project and getting amazing results of what we're looking from what we're finding, and now to write up a scientific paper for publication. It's mind-blowing.
Oh, that's great. That's fantastic. When you open up and you're looking at someone's teeth, you've got all your baseline history and information. What would be one of the first things you look for that of most of what you feel might be of most importance?
I look at patterns. I look at patterns of missing teeth. I look for filling patterns. I look for the wear patterns on teeth. Those start to tell me I'm dealing with a corrupt system, because I'm looking at really from the viewpoint of the system is out of balance. There's something wrong with the system. The end result, the downstream component of the system being out of balance, is damage to the teeth.
Yeah.
So either moving forward from a treatment perspective, oh, gee, Dr. Allison, you've got a broken tooth, you need to have a crown. That's probably true in the limited little world of dentistry. But going back up a few levels, why did you break your tooth? There's something that has caused that tooth to snap, pop, fracture. And so we've come up with this notion, I and a few others, teeth are circuit breakers to the body. So if you use this analogy, the analogy, when the system goes berserk or gets overloaded, something's going to pop, just like the circuit breakers on your electric panel in your house. If you overload the circuit, the breaker's going to pop. Well, it's easy to unplug something in the house and reset the breaker. With the mouth and the teeth, when that goes out of whack, you end up with a broken tooth. That could be a simply fixable break. It could maybe just dust the edge of the tooth off, or you have to put a big filling in it, or you have to put a crown on it, or you have to pull the tooth at the extreme because it's a straight vertical fracture right through the rootstock, which I have seen in my practice. It's amazing. The hardest structure of the human body can be broken by the hardest structure of the human body.
Right. Yeah.
So I've seen that. I'm in practice 37 years plus now, and I would say I've seen everything, but I've seen a whole lot of things. And in this world of medically oriented dentistry, they even take on more bizarre forms sometimes.
Sure. So, interestingly enough, mercury, there's tons of information about mercury out now, obviously. And I found interesting your part in the book about the American Dental Association and their perception or their stance on mercury. So I found that interesting. And of course, when
Yeah.
there are professional organizations, I don't like to say too much about, you know, their positions on things, especially I'm not a dentist, and so I'm not in that field. But with respect to mercury, obviously, there's some interesting number statistics in the book with respect to that. And so do you feel that the mercury issue with respect to whole body health, obviously I realize that there's issues with them in teeth, and I think overall the use is generally down. I would imagine you would be the one to correct on that. But still, there are pervasive issues even once you've taken the mercury out. And so for people who are not familiar with it, or don't have some of the more detailed information, in addition to reading the book, what other pertinent information about that would be relevant for you to talk about, or the effects on the teeth of long-term amalgam placement, or other, from a dental standpoint, what would be your position? Because I've heard dentists say, well, it's small, or it's, the tooth, the integrity, we risk if we take it out, causing more damage and possibly creating other problems. And I realize there are protections when you take the metals out, or there's supposed to be protections, and dental dam and so forth. What's your general position to people? I've heard dentists say, no, they all have to come out, and that's just a general statement they would say. What's your position on it? I mean, is it sometimes it's okay? Maybe it's not that big of an issue. We'll leave it in until there's a bigger issue to deal with, and then take it out, and so forth.
Yeah. So that answer is got so many levels.
Yeah.
And touches on so many component parts. I'll address a couple of them fairly straightforwardly. Mercury is a poison.
Right.
There's no question. Every physical chemist, every chemist, organic chemist, any physician, it's taken out of all the hospitals. It's no longer in thermometers. It's bad stuff.
Right.
The only safe place, it seems, according to the powers that be and the quasi powers that be, to hold mercury is in the mouth, inside fillings. It seems to be the only safe place for it, because before it goes into the mouth, it's considered a toxic material and a hazardous waste. After it's removed from the mouth, it's considered a hazardous waste. So therefore, the only place that it can be safe is in the mouth of a human.
Right.
So, okay.
Yeah, it makes a lot of sense.
It makes no sense. That's a dance that's been done with words and art form in the political arena. On the mechanical side, a tooth is best when it's whole. Okay?
Sure.
The whole tooth is intact. It's a beautiful work of art. It's structurally just the right thing for the job that it's supposed to do. When caries occurs, tooth decay occurs, historically for the last 150 years or so, the most common filling material to be placed after the removal of the diseased part of the tooth was a mercury filling. And the whole story is discussed in the book, but that was the common material. You could be a klutz to put that material into the tooth. I could train you in 5 minutes to place the filling, not necessarily drill the hole, but you could put it in with your thumb and it would work. You didn't have to care about necessarily the dryness, although that helps, and there was no bonding agents that you had to put in and worry about, and it's squished away pretty easily. So it's a really forgiving material on just the material side of things.
Okay.
Using anything else is a much more difficult material to use. Technically, it's a hard material just to place. It's hard to work with, and it requires a higher level of sophistication in your handedness, and so your eye-hand coordination, your attention to detail. So there was a lot of pushback through the years of the amalgam placing dentists that could use their thumb to put the material into the thing compared to what the finesse that you need to have and the delicateness to place the other stuff.
Interesting.
So now just in time, the doctors that would do only mercury, they're dying away. Just natural attrition of people, regardless of whether or not you think dentists die sooner than other people.
Right.
But just because they're dying out, the young people coming up aren't really trained that much, and it's not so big of a deal. And now there are other materials that are comparable in wear characteristics, which was a big thing, longevity, with reasonable cost. So the composite materials of today are much more user-friendly, because and the doctors, the young people coming out of school, they're trained on that early on, so they get that eye-hand coordination, the whole process of how to put all this stuff into the filling, the filling into the tooth early on in their careers. So they come out, they don't want to use mercury filling. It's ugly. It has all those biomechanical problems. It will crack teeth. If you have a big, nice tooth like that, and 90% of it is mercury inside, mercury expands three-dimensionally, putting internal pressure on the tooth, and it goes top to bottom, so the floor of the filling inside, it can't go down, but it certainly can come up. So when it comes up out of the tooth, and like when water freezes in an ice cube tray, it expands. So too fillings expand, and that expansion will crack teeth, or it allows an internal pressure to occur from within. And then when you're eating something hard and it just hits it right, the tooth pops, it cracks, and then you relieve that pressure internally. So you've got the health argument, and then you got the biomechanical argument of why you want to use it or why you don't want to use it. The other component part, directly to your question of, oh, it's okay for everybody. Well, it's not okay for everybody. When you get into the detox pathways with the ApoE protein chain, you either have ability to detox natively the mercury that's going into your body, and it's not just from the mercury fillings. You get it from eating tuna fish, and many fish today have toxic loads of mercury in their body. So we eat that, we get it into our body. But if you have a native ability to detox mercury from your body without doing anything special, then you're in pretty decent shape to withstand the fact that you got mercury in your mouth and it's going into you.
Yeah.
So if you have you can take 4 atoms of mercury out with the one, you can take 2 atoms of mercury out with the other ApoE, and you can take no atoms of mercury out natively. So that means your mercury is going to build up in your system, and it's not going to come out, and it's going to make you more toxic. Then folks like you, nutritionists, putting people on cilantro, for instance, dietarily, or parsley, and different foods, different DMSA, DMPS, different chelating type of agents which can go in and bind and take the mercury out. There's a new one that's going to be coming out hopefully soon called IMD. And it's a natural product. It's a designer natural product. So those folks that can't natively offload mercury from their body are going to need help. They will suffer the consequences negatively, and so too will the other people that only have a partial amount of mercury being able to detox from their body.
Yeah. So as far as you mentioned also nickel, which I've run into quite a few people with nickel sensitivities. And so as a component, now nickel, I think you also mentioned, is present in some other materials, not just potentially an amalgam. And so again, back to the evaluation, do you generally do compatibility testing across the board, or is it?
Well, we offer that to people, and if people don't want to do it, we'll use materials which are most compatible most of the time for most people. That doesn't always work for people. It's a roll of the dice. It's a kind of a considered positive thing that you're safe, but not always. It happened to my wife recently that we thought it was a safe material and it wasn't. So we had a problem with. She had a problem with it. Now, just for the audience, nickel is not in mercury-containing fillings.
Okay.
It's zinc, copper, tin, silver, and mercury. Those are their typical component parts, and no nickel.
Okay.
You will find nickel, though. You'll find nickel in stainless steel crowns, which are the kind of temporary crowns that are put on pediatric patients, children, when they've got a lot of caries on their teeth. They'll put a nickel crown on. So that's a kind of a tender population. So we see people with, and I'm sure you see people with allergies, they can't put a snap of clothing on their skin. It gives them a welt, for instance. Okay, so they have a nickel sensitivity. Well, if you have nickel the crown, not the filling, but a crown, many times is 50% nickel. Okay, so now you've got essentially a permanent nickel implant put into the mouth, which is mixing with the saliva, which is going into solution, these nickel ions, and you're getting a regular bath of nickel into your body, and that can sensitize you to other types of allergies. It just fires up your immune system.
Sure. So that comes to another point, whereas a lot of the time someone may not have inflammatory issues and so forth, but then they have a material such as this put in some of their teeth, and in addition to the toxic load per se, now they're triggering an immune response on top of it.
That's right.
And so it's fascinating, really, that there's so much tie-in. And I think one of the things I was going to ask you, I have quite a few questions. Of course, some of them are off book topic at the same time, I think, but that are very relevant to people, such as, like, recently I had someone asking me, and obviously I defer this question to you because I'm not an expert in that field. Whereas it came out and they said, well, flossing, right? And I'm sure you're aware of this, that it came out and said flossing doesn't really work, right? So, and I don't really know how to answer that question, although I think it's pertinent to a lot of people because I'm surprised how many people have heard about this. Now, I didn't read through this, the information that they were putting out. From your standpoint, and you've been being in practice for this long, what's your view on that and other typical tooth maintenance? What do you tell people? What's best practices with respect to trying to maintain your?
We have a little rhyme that I like, and I've embraced it over the years. Is you don't have to floss all your teeth, just the ones you want to keep. Now, they're a big thing. That was a big splash in back in July, I think, June, July.
Yeah.
Regarding in the public lay media like USA Today and things like that. Right. And my reading of it was that there's just not really definitive studies that show this.
Yeah.
So their extrapolated answer is, well, there's no proof that it works. Well, empirically, I just like me in my practice, you in your practice, you see things that work. They're not measurable in the classic Mendelian or Mendelian way of which was the double-blind studies and all this. You can't do that with a individual human population of one.
Right.
But you do and apply your knowledge of what you do. You're reading the symptom response and things, and you're crafting the response necessary for that one person, not a population. And so many of the tests and things that are done out in the world are population medicine for large groups of people, and statistics can be so twisted and made to look appealing, and they're absolutely a farce. So that's my answer around that one topic. We want our people to floss their teeth. You've got to disrupt the biofilm that's going to be clinging to your teeth. Every dentist watches this in mouth. There are immune responses. It's a complex issue. Biofilm is a complex disease entity that has different levels of virility or damaged possibility to the body.
Yeah.
So Marfan's is a biofilm disease. A Staphylococcus coagulase negative organism creates a damaging biofilm from a mold toxicity.
Mm-hmm.
So that's a whole other layer, and
Yeah.
I'm kind of involved with that in part of my research project. So that's what I'll say about flossing. It's something that we, you're only going to clean certain parts of the tooth by flossing, and actually, if you have good, healthy eating habits, you eat well, etc., you're going to have a robust energy system. Your colon's going to be in good shape. Your all the systems are going to be working. You won't need to have probably as much of that. But
Yeah.
when you have a bad diet and your energies are bad, you can have inflammation in the gut, which is going to reflect a cavity into a tooth.
Sure.
So those are inside-out problems, and so flossing and brushing is an outside-in problem. So you're trying to take care of it. It's like a fluoride is throwing fluoride at a tooth to prevent tooth decay. Some of the worst decays that we see are those teeth that have been in fluoridated areres that make the enamel really hard. They don't stop the holes in the top biting surface of the tooth, and because the fluoride makes the tooth so hard, the X-rays don't penetrate the tooth as well. Now you even open up a tooth, you have a big crater inside the tooth.
Yeah.
And the tooth look normal.
Yeah. Yeah. The fluorosis is very interesting. Is that now? Thanks for the explanation about the flossing. I know a lot of people. I mean, it makes sense, right? And empirically, like you're saying, or anecdotal evidence, same thing. Like you said, I see that here. I've seen it with things you see in practice that don't necessarily equate into the research that's been done. And
Right.
interestingly enough, like the EAV or the electroacupuncture, we are capable of and do some of that here, which I find fascinating because it correlates with most of the laboratory work that's done. And so, like you said, there's a lot of other things involved that we may or may not be aware of,
Right.
but provide proof of what seems to be the outcome that you're seeing. And so, one of the things, and it's interesting that you mentioned the cilantro, because I had read about that a while back, and which is very cool, and that it seems to be very effective.
Yeah.
Now, are you telling people or prescribing them to use cilantro in a like a clinical form?
Yeah,
or
dietarily, they just eat it as a
Mhm.
pesto and mix it with olive oil and
Right.
mash it up, and that's a good way to take it. Cilantro is rich in sulfur bonding groups, and sulfur attracts mercury very well, so it binds that and then it's able to be carried out of the body.
Yeah. So that's one of those pieces of information that it hit the media and then disappeared for a little while. But when I actually read that one, and I don't remember the numbers, but the effectiveness was pretty impressive.
Yeah.
So, what's something you mentioned the research study that you're doing with respect to future forward in holistic dentistry? Where do you see it going at the moment? Like, what's kind of the new exciting things to look forward to? I've heard about 3D teeth construction. You mentioned zirconium in your book. I have zirconium implants. What would you speak to? I saw someone I think doing like 3D mapping of root canals, so that they potentially in the future could use zirconium or another material to drop into the canal, or the mapping of the canal, so that it would actually fit like the original tooth.
Yeah, those are. I'm going to answer a little differently than kind of the direction that you're going. And
Okay, sure.
The new thing from what I'd like to, my desire and my thing that I'm going to put out there to you is going to be awareness of other doctors to be involved more fully and completely inside holistic dentistry, and embrace the book, a lot of what I have in the book is just very mainstream. It's just separate. It's
Yeah.
all different separate pieces, kind of like ornaments on a Christmas tree. They're
Sure.
separate.
Yeah.
When you step back, you can see how everything is laid out, and it's pretty and it's sparkly, and you take it for the whole. That's really what the book is about. So
Yeah.
I've got enough separateness that's mainstream, but
Yeah.
now bringing it more together. So that's
Yeah.
what I see on the horizon for the population, the public,
Sure.
or awareness of the practitioners, regardless of the whiz-bang techniques that are developed,
Yeah.
or to support that. That would probably stay just in the hands of a small group of people.
Yeah.
This is a bigger problem. This is a bigger healthcare issue than
Yeah.
what what the whiz-bang mapping of a canal is going to be.
Right.
Save one tooth.
Yeah.
We're talking about saving the
Well,
the population.
that's what the one thing I wanted to tell. I wanted to tell people because I feel this way about this this book, The Holistic Dental Matrix. I've been a long proponent of people educating themselves about their body and how to take care of it so that
Right.
they can actually start taking care of their body like they would take care of their car or their house or anything else that's considered an investment or important to them. And so that it continues to function well. And I have not seen so far a book like this where this could be a very, it's concise enough that like you said, you've covered a wide range of information that is directly applicable towards educating yourself about your teeth and some of the other effects physically and what the potentials are there and why that's important and the things that have gone on with respect to dental care historically. And so I really am impressed with it. That the fact that it is this concise but yet covers all the things that are really important. And most people don't know. I mean, they don't know if they're grinding at night, and if they are, well, okay, so, but it's important, like you said, like I know someone who vertically cracked a tooth. It appeared to be, and it was a divergent tooth, I guess, as they call it, purely from grinding over time. And eventually, I mean, this is what they were told, and it makes sense to me. And eventually just split the tooth in half when they were eating rice or something. But I think that, they had created a crack in that tooth, and they wouldn't have never known that because they hadn't been told that they were grinding. So they never even
they don't connect it.
Right. So
it's a disconnect. There's a disconnect in healthcare, and it's filtered into the population. The people don't know. They just don't know. And so the book is my attempt to give the concise kind of a go-to guide to help be educated about things in general, because it's all hooked together. This is just part of a closed system. And we got even into micro stuff. That's a part of a closed system, but it's a system. And so I came at this as a systems viewpoint.
Sure. Yeah. Well, I mean, your teeth are growing out of the rest of your tissue, so it kind of makes sense. So.
No, but a diseased tooth can be pushed out.
Yeah. Interesting. Yeah. I wanted to ask you, are there certain things like certain teeth that culturally suffer more, like by position or build, that suffer more in our culture? In other words, something you see, whether it's certain incisors and so forth, or molars that seem to suffer more at the state we're in the culture now. Something that's a repetitive issue that you see.
The mouth is an equal opportunity destroyer.
Okay.
So,
Okay.
It's a system that's out of balance, typically, that is taking the brunt. Then all the parts of the system are suffering excessive wear.
Yeah. Yeah.
So if you think of a car, think of tires on a car. When the tires are properly balanced, they have nice uniform wear. You've got good front end alignment. But if you're driving around on half-filled tires and your front end's out of alignment, yes, you can go along and you can do this, but you're going to get terrible wear pattern on the car. You're going to have a much shorter life on the tires of the car, and then you're going to wonder why, well, gee, I only have 20,000 miles on my tires. Well, how did that happen? They're all bad. So same thing with similar analogy with teeth.
Yeah, yeah. Well, I think what I'd like to do is maybe we'll set up another time to discuss some more things in the book, so that because I'm sure that I'll get some questions
Sure.
about the content and certain things that would be beneficial for people to hear, or be reinforced.
Sure.
And I'd like to get into, there's a lot. I mean, from my perspective, as a clinician, and what I see, because I do a lot of amalgamated approaches to things, not amalgams, but you know what I mean,
I understand.
in terms of health in general. And so these things come up, and how they're associated, and I'm still learning too. I have my dental chart, correlating body parts over here and meridians and so forth. And so I find it fascinating, and I think with your history, there will be a lot of things. I have all kinds of questions that I can come up with, and I'm fascinated to hear what your responses would be. And so before we go, one other thing I wanted to ask you too is about modeling, or the white, speckling in teeth in general.
Yeah.
Now, a while ago, I had a dentist tell me that they thought that it was calcification, but they really didn't honestly have much more to say about it. And so I was looking at, is this a fluoride side issue because of calcification or absorption and so forth? Do you have any input on that?
Yeah, it's pretty clear what it is. It's a disturbance in the mineralization of the tooth caused from the fluoride.
Yeah.
That's the bulk of it.
Yeah, that's what
A
I
simple
had.
15-second answer.
Yeah. Well, that's what I had read, but I would always want to hear professional opinion.
Yeah.
So because a lot of people come in that have that, and they wonder about it. Now, they don't give it a whole lot of thought, I think, a lot of the time. But from getting into some other things, maybe we'll get into future forward, which is like thyroid association. And so I see a lot of that, but I also see correlation in the discoloration as well, and
Yes.
which is directly tied to, or can be directly tied to, fluoride as well. So it's fascinating stuff. So I appreciate you taking the time to do this. A lot of people, I think, are going to, again, I'm recommending that to our patients as well, that they read this, because it is one of the things I think that's underappreciated in terms of dental care. And a lot of people don't go for dental care until they have to go for dental care.
Right.
And so I look forward to talking with you again. I'll try to come up with some more intelligent questions.
Oh, you're doing really well. I want to say that anybody that has available a computer can get a free Chapter 1 download, which has the matrix chart in it, a complete table of contents, and individual chapters are available for purchase on our website. So if you want a special interest topic, you can just get special interest information.
Yeah, no, that's great. That's a great way to break it up too, because I'm sure when people are interested in something, whether it's they're being told they need a root canal or they need crowns and so forth, and like I said, that's usually what happens. They wait until it's absolutely necessary, and then they've got to rush and learn everything as possible. This is great information. So
it's only available on our website, drnicholasmeyer.com.
Okay.
The physical book.
drnicholasmeyer.com.
Yeah, so Kindle's available and Apple for e-versions.
Yeah, fantastic. Okay, Dr. Meyer, I appreciate your time, and hopefully we'll get back to try to set up something so we can continue our discussion.
Perfect. Okay, well, thanks.
Good to see you.
Yeah,
Take care. Have a good day.